Hey there, everybody. Dr. JP Guidry here. Hope everybody's doing well. Today, I want to talk a little bit about pain and the science behind pain. This is going to be a two-part video series. So, the first part is going to be covering kind of the history of pain science and then where we're at today. The second part will be more approach to treatment of pain, both acute and chronic pain. Um, so pain itself can be a very scary thing. It can create a lot of fear. And the more fear it creates in patients, it kind of turns people into their own worst enemies. They feel like they lose control over their bodies and their abilities, which only adds to fear. And that fear can keep people from doing the things necessary to get better and to live productive lives. So within that fear, knowledge becomes a very powerful tool, and that's what I hope to gain from today's talk is sharing some credible information with all of you about pain so that we can hopefully temper some of that fear that goes along with it and guide you in becoming your own best advocate. I want to add the disclaimer that this is not medical advice, but it's an educational material only. If you feel like you've suffered a significant injury or have symptoms of a serious medical event, please contact your doctor immediately. So first, I want to just talk a little bit about the history of pain and pain science. So we start with Rene Descartes. He had a very singular bottom-up approach, essentially that the tissue was injured. We have pain receptors that would carry the pain signal to the brain, and then the brain would cause you to remove your foot from the fire, so to speak, as the picture shows. We now know that pain is a much more complex experience than this, which we'll get into a little later on in today's talk. This kind of evolved into what we call the gate theory, and this is what, if you've ever used a TENS unit, ice or heat, this is kind of what this goes after. And this would look at pain as we have pain receptors, but we have different nerve fibers that bring the pain to the brain. So we had an A delta nerve fiber that was more for quick, acute, intense pain, and then C fibers, which were more throbbing, chronic pain, and those both would carry signals to the spinal cord and into the brain. This again, while those things can help kind of alleviate pain and maybe block the pain temporarily, we now know that this is a much more complex process, which we'll get into now. So where we're at now with pain is the neuromatrix theory or the biopsychosocial model. So essentially what that says is we have all these inputs coming into our brain. Some of them biomechanically, so that's from the tissues themselves. So we have too much strain on tissues, actual injury to tissues. We have them from the psychological part, so stress, depression, our thoughts, our fears. I'll go into that. And then it's a two-way street. So our pain and can change the way we think, can change our stress, can change our fears, our beliefs as well. Our culture, our society, our social, our families, the people we hang out with, all those things kind of play a part in our pain experience, and can be affected by our pain experience. So we know the point of this is we know now that it's a very complex thing. There are so many factors that come into play when it comes to pain and injury. So all of our signals, all of our sensations we experience are carried through the nervous system, and it's a big interconnecting system. Although it's multiple nerves, it's essentially one big system that consists of, over 400 individual nerves over 45 miles throughout your body. We have nerve cells, basic nerve cells called neurons. These transmit the signals of our senses to the brain. We have specific neurons called nociceptors. These do not detect pain. They detect potential dangerous stimuli, which that is then sent to the brain. The brain interprets that message along with a bunch of other incoming information and decides whether it's going to create a pain response. So the brain, we don't have necessarily pain fibers or pain nerves. We have nociceptors, but those things don't always result in a painful response. Essentially, the nervous system and the brain act like an alarm system for our body. So, example would be if you bend your finger back or I'm uncomfortable. If you keep going, it will then become painful. This is your body warning that if you keep doing this, you could potentially cause damage to your finger. So it creates a signal of discomfort and then pain to stop you from doing it. So it's our alarm system that either something could go wrong if you keep doing what you're doing, or something has already gone wrong. When injury does occur, our initial response is to protect the body. So again, we create pain so that we, don't move the body. We don't put weight on the body part. We don't continue to overstress it or to do what created the injury in the first place. As well as it creates other protective factors around it. So muscle spasms, tight, tense muscles, limited movement, altered movements, compensations, things like limps, weakness, guarded posturing, or other altered sensation are all part of this alarm or this protective response. So let's talk a little bit about injury or harm. So when a tissue is actually injured, it's caused by some combination of three factors: force, position, or repetition. If any combination of these three factors is greater than the limits of the tissues, injury can happen. And this could be very minor injury. This could be very severe injuries. But what occurs in the tissues are only one component of the pain experience. So tissue changes are not deemed a threat. If they're not deemed a threat by the brain, then we don't necessarily get pain with that change in tissue or that injury to tissue. Some examples would be, this one's a little older example, but I still use it. A basketball player named Kevin Ware played for the University of Louisville, severely fractured his leg in the NCAA tournament. And he reported in an interview that he didn't feel any pain until he actually saw his foot essentially hanging to the side on his leg. So that visual input is what triggered the pain. But the fact his foot had been fractured for a while before he actually saw that, minutes at least. And so that the injury itself didn't trigger the pain. It was when he saw it, that's when he kind of started to panic and the pain set in. Others examples are, soldiers on the field of battle, experiencing, all types of injuries, but still being able to kind of get to where they're going, complete the battle, get to safety, save others, whatever they're doing, because the brain deems that activity more important for survival than the injury itself. And lastly, another example I like to use is if you were crossing the street and you sprained your ankle, but there was a bus coming at you, more than likely you would not feel pain immediately, because the brain would recognize that, again, the brain's trying to keep us alive. So the most immediate danger is the bus. So you need to get out of the way of the bus. Now, once you got to the other side to safety, then the focus may go back on the foot, the sprained ankle, and then you may start to experience pain and symptoms from that. Let's look at healing. Let's talk about healing. So we injure ourselves, our body goes through a, fairly straightforward stages of healing. Our body, as humans, we are wonderfully equipped to repair tissue. We're great healers if we provide the right environment to heal. And part of this, providing that right environment, is maintaining our health. So maintaining a regular exercise program, maintaining good nutrition, good mental health, good sleep. All these things will set us up for better healing in the long run. So all our tissues go through a normal healing process. Acutely, we have inflammation that floods the area with immune and rebuilding cells. That's where we get the swelling and a lot of things that go along with that. Once the inflammatory process is over, the tissue starts scarring down if it's that type of injury. And then lastly, the tissue then remodels itself to attempt to become as good as the original tissue. And in some cases, it becomes even a little stronger. Blood supply and tissue to the tissue help determine how fast this healing process takes place. All tissues generally heal within about 3 months, give or take a few weeks. Sometimes this response The response to this can occur long after the healing process has taken place. So the tissue can be healed. You can still have pain. You can still have swelling. You can still have some of these byproducts of healing. So we talked about tissue damage. Now let's talk about what actually causes pain or hurt. So we define pain as an unpleasant sensory or emotional experience originating from your nervous system sending information to your brain, and your brain then interpreting that information as a threat. Danger signals can come from triggers from nerves picking up information from all the body's tissues. This information can consist of chemical inflammatory changes in the tissues, mechanical changes to the nervous system, either being stretched, pinched, or lacking blood flow, temperature changes, such as very hot, very cold, that could potentially cause tissue damage. Although these triggers usually come from the tissues, they can also come from our immune system, our hormones, from a stress response. Psychologically, memories, fears, and anxieties, all these things can trigger our pain. The brain and the spinal cord can either turn up or turn down that danger signal or that threat response, making nerves in the area of the injury or the potential injury more or less sensitive. So it can work both ways. We can either increase the sensitivity, which is more of a protective response. So it's going to be more sensitive to movement, pressure, touch, things like that. And it can also decrease it if it deems there's more important things going on. If that area does become sensitive, then you can have things like spasm, muscle tension, protective posturing of that area. That's when the body goes into that more extreme protective mode. So while pain is very unpleasant, we've all experienced it as a very unpleasant experience, is a necessary experience. We wouldn't live very long without it. It's part of our alarm system. It helps keeps us alive. It helps keeps us out of danger and help promotes that healing process. Pain only indicates that something dangerous may be going on. So think of it like your check engine light. When our check engine light comes on, it could be anything from a very severe problem with your engine to, in some vehicles, it's just a loose gas cap. So pain is the same thing. Pain just tells us something is going wrong. That could be a serious tissue injury. That could be, even no tissue damage, but telling us that if we keep doing that thing, we may potentially cause damage down the road. This is why we like to use the saying, hurt does not always equal harm. So when we look at things like imaging, they've done these in the spine, they've done these in the shoulder, they've done these in the knee. We understand that. We look at the spine, we know that if we image, and there's a lot of studies showing this, that if we image healthy people without not experiencing back pain, anywhere from 40 to 80% of those will have some damage shown on their imaging. So the X-ray and the MRI, things like bulging disc protrusion, stenosis, arthritis, and annular tears can be found in these patients that have no pain. Same thing in the shoulder with labral tears, bicep tears, rotator cuff tears. Same thing in the knee with meniscal tears, arthritis. So the point of this is understanding that these things don't always equate to pain, and you can even have pain and have these findings going on, but those things not even necessarily be contributing to your pain. So while imaging is important, take all imaging findings with a grain of salt and understand that it's just a picture of your body at one particular point in time and doesn't really tell the whole story. Lastly, let's talk a little bit about persistent pain. So this is pain that lasts for more than the tissue healing process, so more than that three-month process or so. It's essentially an abnormal, prolonged response to your injury or a threat. It's basically a malfunction of your body's alarm system. So if you think of it as if we have a car alarm, it's meant to go off when someone breaks into our car. So that's the normal response. Persistent pain or chronic pain would be that alarm going off every time a leaf falls on it, every time the wind blows. That alarm system is firing off even though the tissues are healed, and it should not be doing. The problem with that is the longer we're in pain, the better we become at being in pain. So the more triggers that become associated with that threat, we get more sensitive to things, and we tend to, snowball into less activity, more pain, and just become more debilitated and more of a pain dealing with that pain more and more. How we experience pain is very individual, so it's based off of our past experiences, our beliefs, our knowledge, our environment, our expectations. So everyone's going to be different with this. Don't let anyone tell you how you should feel or what kind of pain you should be experiencing, or try to tell you it's all in your head. While there are psychological components to pain, what you feel is very real. It's a very real sensation. So, if this is something you're dealing with, find someone that's willing to talk with you and not kind of write you off because of this. Um, so if you're experiencing chronic pain, it's generally a result of the brain concluding that for whatever reason you are still under a threat, even though your tissues are well healed. In some people in this situation, that alarm system never returns to its normal resting level, so it always stays in a kind of heightened state, which keeps us much more sensitive to um, uh, anything we experience. That sensitivity can also be affected by our habitual positioning, which is why novel movements, novel activities, new things, putting our body in movements and positions, which we'll get into part 2, um, is important. And these postures can be related to our work, our leisure activities, as well as stress, fear, mood, environment, so on and so forth. Um, Chronic pain is still a very complex thing and not very well understood. We're still trying to figure out, why certain people go this route and why others heal like they should and the pain goes away as it should. But we will talk about in part 2 some things we can do to treat and to deal with chronic and persistent pain. So that's been part 1. I hope you enjoyed the talk. Hope you gathered some knowledge. Like I said, in part 2, we'll talk a little more about the treatment approach to both acute and chronic pain. If you have any questions for me, again, my name is Dr. J.P. Guidry. You can reach out to me via email at johnpaul, JOHNPAUL, @guidrypt.com.